Hi everyone, I'm Steve, back here with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center, as you all know, if you've been watching these interviews, is in Reno, Nevada. And we're going through a series of different treatments, IV treatments that they do at the clinic, Biointegrative Health. So you can check them out online. Welcome, doctor.
Hi, Steve. Thank you for having me again.
Okay, so let's talk about chelation, also known as EDTA. So it's a bag, IV drip, right in the vein. So what is chelation?
Well, Steve, that is that's one of the more popular, or what we call the bread and butter of our practice. And I always want to start off with patients thinking that, think of a magnet binding metal in your system, like an external magnet. Then as you push the flush from that toilet, then it goes down the drain. Thus, it binds all of these metals in order for you to release it easy, quick, and fast. This is not the as easy as what it's happening to be, but just an easier way to visualize it. Well, metals are like scum dirt. Maybe this is something also another visualization exercise for everybody. And it sticks into the vital organs. It's hard to reach. The longer it sticks, the more it does damage, especially through the vital organs such as the brain, the heart, the liver. And we need a special antidote to remove these heavy metals. Thus, EDTA. I don't want you to memorize this, but EDTA means ethyl and diamine tetraacetic acid. All right, too much of a tongue twister, but that's what EDTA means. And the Greek word chelate means claw. That's why chelation. Thus, the organic molecule, EDTA, binds to a positive charge molecule, which are your metals, in a pincer-like fashion. So that's why it grabs it to take it away, going to your kidneys, to your liver. And these tight bonds, which are binding to heavy metals such as mercury and lead, as the most common heavy metals, and also notorious excessive minerals that can build up, such as calcium, are removed throughout the system. But another familiar term for everybody, EDTA, is always heard in the laboratory, like in your blood draw place, because they use this in tubes as an anticoagulant. These are usually the purple top tubes that we see in LabCorp or Quest. And again, chelation therapy is known for the cardiovascular benefits, especially in the intravenous form.
Yeah, I know I always get the IV there at the clinic. And I did read that EDTA before we got on camera here, and so don't worry, I'm not going to memorize it. EDTA is good enough. So, are there other ways? I know that I always get an IV. Are there other ways to administer this treatment?
So, Steve, there are. It's not only IV therapies, but one more common one is oral. It's easy to take, commercially available, even in the internet, you can buy it. But it's the least effective due to the gut absorption differences of everybody, and only it can deliver small doses because there's only so much you can give orally in a very safe way. Though common side effects of oral chelation is nausea. Another form would be skin cream like Bengay. Why do I compare it to Bengay? For the reason that it can be applied in different areas of the body, especially for skin skin tissue problems or anything below the skin, basically more of the joints. A good example for you is when osteoarthritis comes into play. We're talking about excess calcium deposit. Thus, calcium can be removed by skin or a topical EDTA. It's easy to use, very economical, but limited absorption on the surface where it's applied. Long-term effects, it's going to be probably a push for you to see But again, as you can imagine, it's very slow in terms of process of effectivity. Another one would be soaks, comparing it to like pedicures and manicures. Hands and feet being soaked with EDTA. So this mixture sometimes is mixed with vodka, 6% hydrogen peroxide. There's so many ways in how to do this. So again, people might take a little shot while they're making their concoctions, but this home do-it-yourself solution only has limited evidence. Another one is enema or rectal suppositories. If you're a big fan of sticking things in crevices far, far away, this is probably your thing. But majority of my patients, they're not like that. And this minimizes the nausea and stomach cramping associated with the oral form. It's inexpensive. It bypasses the stomach or the gut for faster and more absorption. It's quicker and also fully absorbed within 30 to 90 minutes, actually. And the disadvantage, as I mentioned to you, is it invasive or non-invasive? Depends now on how you define invasiveness. And not all the colon is covered, even though when you're talking about suppositories, it's just going to be at the end part of your colon. And also, if you do enemas, again, it's not going to cover the whole colon. But again, you only want to expose EDTA, the medicine, to blood vessels so that it can be a systemic therapy. And the go-to of the clinic of our practice is IV therapy. This is a more, of course, higher price type of approach, time consuming, maybe 60 minutes or longer as a procedure. And if you're a fan of getting stabbed in the arm, sure, this is one thing that you can definitely be going for. And it bypasses the stomach to alleviate the intestinal side effects, which I just mentioned, and it's the most effective and backed up by medical studies. And just for everybody's nice to know fact, EDTA's half-life, or it stays in the system up to its 50% content, up to 8 hours. So mostly excreted through kidneys, bowels, urine, and of course perspiration.
Okay, so I want to talk a little bit about the history of chelation because it's pretty interesting. Now, I'll correct me or modify what I'm saying, but my understanding is this goes back quite a ways, World War II, where they started doing this, and they started to find out, I guess they were maybe using it to detox lead or something, but they found that there was some other benefits. So
Right.
talk a little bit about the history of this treatment.
Well, Steve, let's take a little trip down to memory lane. Though I'm not the best in history class, but let me just give you two basic highlights of the history of chelation. It all started in the 1930s. It's where the textile industry actually needed something to remove calcium during the dyeing process of food, clothing, and as FDA actually approved this specific substance called calcium EDTA. This is what they found to remove the dyes or calcium from the dyes to make it stick more in clothing or even in food products. But now FDA went that far to actually approve calcium EDTA to remove lead. Thus, it's actually approved for lead poisoning. And another indication would be high calcium levels in the body. But this is the one where you change your EDTA solution into disodium EDTA rather than calcium EDTA. So it's stronger in removing calcium. And in the 1950s, now as we can see, the progress is there. IV chelation for lead toxicity resulted actually in improvements. Now they have correlations since 1950s of the cardiovascular system. Especially it was tried out initially on patients who has bad circulation, or called peripheral vascular diseases, and even diabetic circulation problems, where amputation and gangrene of the foot was prevented.
Okay, so yeah, it's interesting. It goes way back. So talk about some of the benefits. If somebody's going to come in and they want to get this treatment, what type of benefits, just mention some of the benefits they can expect to receive with this treatment if they do it consistently.
Well, Steve, the number one benefit that we always see is actually the removal of the environmental toxicants associated with cardiovascular disease, specifically lead, arsenic, mercury, and cadmium. The mechanisms: EDTA can act as an antioxidant. It promotes actually less inflammation. And when you talk about these heavy metals, they actually affect the function of the blood vessel lining, which can lead to increased blood pressure and induce renal dysfunction, or your kidneys not working well. And cardiovascular diseases such as plaques in your blood vessels and even high blood pressure are ones that we usually have a high indication for in relation to its use. As we all know, number one cause of mortality in the world is cardiovascular disease, and lead exposure actually adds to this phenomena. It actually increases the formation of plaque, reduces the actually reduction of exposure to even lead has reduced cardiovascular diseases, including diabetes, extensively. And the metal pollutants are always, such as the lead and mercury, are always present, most of the time present in diabetic patients. So as you can see, these cardiovascular problems, they're mixed with these heavy metal toxicities. And EDTA removes metals involved in all of these disease processes. But of all the metals, let's focus on two. Lead. Lead is in our soil, fertilizers transferred actually in our food sources, bullets that we use for the gun aficionados, even lead smoke. Cigarette smoking has actually lead in it. Paints, who I don't know if you're living in an old house until 1978, but the lead paint is still there. Lead gas, actually lead content reduced 90% in the US as of January 1, 1986. And 10 years later, lead gas was completely banned for on-road vehicles. That's how bad lead is. And even lead pipes that actually can lead to your water contamination because we shower, we drink it, we gargle, thus mucosal membranes are exposed. And another common one is mercury. This is when we find it in fish who swims in polluted waters, and these are the larger fish that actually accumulates it like a sponge. And I don't know where people are still playing with mercury thermometers. And another culprit would be removing the excess iron from the body. So this is where iron or ferritin or iron stores are high. It can be found in our water contaminants, and also iron skillets if people like to cook on their iron plates. And special note, people who has a urinalysis where they found calcium oxalate crystals, wherein the body could actually dispose more easily through the urine and sweat by the assistance of EDTA.
Okay, last question, doctor. So what's a typical protocol? If you find someone, okay, we need to give you a protocol for this, what would be a typical protocol for this treatment? Are there treatments that you should do before or during, or what would it be?
Our basic protocol, Steve, is if somebody is going to go through chelation, actually decides to do a specific round with us, we promote detoxification initially. Why is that? Because we need to remove other contaminants in our system to lighten the burden, so we can just focus on leaving the heavy metals there, and EDTA can do its thing directly without any distraction. So what other detoxification elements are we talking about? So we're talking about, of course, the parabens, other chemicals that we have, chronic infections that are active. We need to put them down and keep them calmed down so that the body needs to just focus on removing heavy metals. So it's a protocol, but let's focus on EDTA by itself. The most common I use, again, I do use EDTA suppositories, and I don't use the over-the-counter ones, and we always want to go for compounded, which is surefire quality assurance for our patients. And even enemas, sure, I've done it before, not myself, but other patients. but 3 days on, 3 days off, a good protocol for 1 to 2 months at a time, and then we check labs again. But again, going back to the bread and butter of the practice, IVs. The range would be 5 to 20 separate IV therapies in the clinic. Again, that's just a ballpark. Depends on your blood test, depends on your history, depends on how heavy the contaminants of heavy metals in your system. And again, blood is not accurate, but I use it as a clue. If I find something there, that's already a big sign for me that there are heavy metals roaming around the system. But a more accurate one to test for heavy metals would be a hair analysis. And the most accurate one is a 24-hour urine challenge. So that's a whole process. But to give you a back support for the studies that actually supplements the use of chelation therapy is the trial to access chelation therapy published in the Journal of American Medicine, American Medical Association in 2013. So it's AMA who actually published this. And they said that EDTA-based chelation therapy reduces cardiovascular events in post-heart attack patients treated with their medication. So meaning you can actually take chelation therapy with your prescription medicines. And as part of our protocol, we add high-dose vitamin C's and minerals to increase the reduction of cardiovascular events. And also the benefit of the combination of EDTA chelation and vitamins is there because EDTA depletes your natural vitamins as you remove heavy metals. That's why after, maybe the day after or a few weeks after, a few days after, we give vitamin therapies just to promote these specific good effects of EDTA. And reminder, chelation therapy is very safe with trained and experienced professionals.
Okay. Thank you, doctor. One of the great treatments done at Biointegrative Health Center. It's Dr. Nario, Biointegrative Health Center in Reno, Nevada. You can check him out online. Thank you, doctor.
Thank you, Steve, for having me again. Always a pleasure. As we all know, that knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.